Hello, my name is Sarah Mackay. I am a Senior Project Officer here at the Department for Health and Wellbeing in the End of Life Care team, and I am also joined online with my colleague Amber Bissett, who's also a Project Officer here, and we're really excited that you could come and this morning and hopefully you've got a cuppa in hand and ready to I guess there's lots of information here for everyone, and we hope you find it valuable. Like to acknowledge today that the traditional owners of the land on which we meet, and I pay my respects to their elders past and present, and extend that respect to other Aboriginal and Torres Strait Islander people who are present today. So just to run through, I guess, the outline of what's happening today, we want to tell you all about the Support at Home program, End of Life Pathway, and the supports that are available to people in the community and how to access them. Today we will we'll give you an overview, eligibility funding and the available supports, how you can access and get help at home, some of the roles and supports for carers, and where to find more information. We have, yes, again, some very wonderful passionate people and experts here to talk. We have Shyla Mills, the Chief Executive Officer of Palliative Care South Australia, Helen Brown, who is an Executive Manager, Marketing and Community Engagement for Carers SA, and Lindsay Moore, who is a Palliative Care Navigator for Palliative Care Connect. And I'd like to thank every one of them for making the time today as well to present. Without any more interruptions, I'm going to hand over to Helen to kick off her presentation. Thank you, Helen.
And thank you for the introductions, and also a very big thank you to SA Health for coordinating this and including carers as part of this important information session, recognising that the role of unpaid carers when supporting someone end of life or going through palliative care can be a very challenging time for all involved, and to be able to share information for carers supporting someone in this space is really vital. So thank you. So firstly, I'm going to give a bit of an overview about who is a carer, because we often find that people who are in a caring role don't firstly realise that they're a carer. We often hear people saying, I am someone's mother, I'm someone's partner, I'm someone's son, I'm someone's friend, I'm not their carer. And it's important to have these conversations like we are through these webinars, through these information sessions, and also through our work with health professionals and other sectors, so that we can best connect people who are in caring roles and may not realise they are to the supports that they need or would best support them in their role. So firstly, who is a carer? So anyone is a carer who provides any form of unpaid care to a family member or friend who may be living with a disability, a mental illness, dementia, a chronic health condition, an alcohol or drug dependence, someone who is frail due to age, or caring for someone who is end of life or has an illness that is terminal. We acknowledge that for carers going through this time with a family member or friend, as I mentioned earlier, they may not realise they're a carer. And we also know that if a carer doesn't get the supports they need, particularly when supporting someone through end of life, that can add extra pressures for the individual, the carer or the other carers, because sometimes there are many people supporting the one person. So it's really important that we all work together, Carers SA, across with palliative care teams, hospitals, other health care professionals, and anyone else who are wrapping around supports or connecting with people end of life and their families and carers, so that these conversations can be had early, so that carers can get the supports they need. So carers can be as young as 5 right through to older age. And what does the caring role look like? So these are some of the things you can see on the screen that Sarah's put up here. Carers can take on all of these things, some of these things, and there may be some other things that carers are doing that aren't featured here, but these are some of the common roles. Sometimes people think of the more obvious, such as personal care, but caring can also mean things such as providing emotional support, advocating for the person you're caring for, supporting with grocery shopping, getting meals sorted, working out the medication regime, medical appointments, taking people to medical appointments, helping to communicate, looking after all of the household, paying bills, and for young carers, it could also mean looking after their siblings. So it could be a whole range of these things that takes on what the role of a carer. Anyone, anytime can become a carer, and we know nationally there are around 3 million carers, and these are the people that realise they're a carer. So we know that there are so many other people that we're not connecting with who, as I mentioned earlier, firstly don't realise they are. And the next slide will show you what these figures are for South Australia. So we know that in South Australia, there are 245,000 carers or unpaid carers. So when I say unpaid carers or carers, I am meaning the same. We see anyone, as I mentioned, caring for family members or friends as an unpaid carer. Unpaid carers in this conversation today are not people who are employed or who are volunteering in roles, whether it be in aged care or disability. This is very different. These are the family members or friends supporting someone. Regardless of whether someone is managing employment, but also a carer for their child or a parent or a partner, they're still considered an unpaid carer because of that. You may be receiving an allowance through Services Australia or Centrelink. You're still considered an unpaid carer in this sense. And we also know that there's a large number in this state of young carers under the age of 25, which you can see on the screen there. Thank you, Sarah. So who are we? Who is Carers SA? So we are a statewide peak advocacy body for carers across South Australia, and we are also what is called the carer gateway provider for South Australia. So we not only provide advocacy on behalf of carers, but we are the statewide service delivery organisation for carers across our state. And we receive funding from the federal government to deliver what is called the Carer Gateway. So many people are familiar or somewhat familiar with My Aged Care. So that's around the country, providing supports for people who are ageing. We also have NDIS available to people living across the country living with disability. And the newish one is called Carer Gateway, and that is specifically for carers across the country. And in South Australia, Carers SA is the main service provider for those services. So what are some of the services we provide? So we provide these 5 services you can see there in that first section. So these include professional counselling for carers, whereby we know many carers are experiencing their own mental health challenges, particularly in this time, supporting someone end of life. There is a sense of grief and loss even before the person may pass away. And so we are there for the carer. So professional counsellors, free services, free counselling for the carer. We are also able to provide coaching. So coaching is one-on-one support where we are able to provide support for carers where sometimes carers may just feel a bit overwhelmed and aren't sure where to start about something in particular in their life, and they need someone sometimes independent of their family or network to talk through what may be feeling overwhelming for the individual, and together with the carer we can help unpack and put some steps in place. We also are able to offer peer support groups. So these are online or in-person support groups where carers can come together online or face-to-face with other carers to bridge sometimes what carers describe as being socially isolated and disconnected at times. So these support groups are for carers. People can come together with other people who may be going through similar things and are able to connect in that way. We can also provide packages of support, tailored support packages, where we may be able to assist with planned services such as respite, support in home, or items to support the carer, where we can fund that, as well as emergency respite. So where a carer has an unplanned or an emergency event, we are able to provide support for the carer by way of providing emergency respite when the person they're caring for may have no one else that the carer can tap into in their network or family to provide support while the carer may be having a medical emergency, for instance. We can also provide, outside of those carer gateway services, carer breaks across the state, and also one-on-one support for young carers. Thank you, Sarah. So some common questions I'll cover on the next couple of slides that we often get asked. Thank you. So can carers access support from us in conjunction with NDIS or My Aged Care? And the answer is yes. So our services are aimed to be complementary to what supports a carer may be already accessing. So if someone is accessing those other services and supports, it is not a barrier to connecting with our services. As I mentioned earlier, some carers are receiving a carer allowance or carer payment or other forms of allowances through Centrelink or Services Australia. Our services are not income tested, so it doesn't stop a carer from connecting with us if a carer is accessing these supports or not. Can carers providing foster or kinship care still receive assistance from us? Yes, they can, as long as the supports provided for the people that are being looked after relate back to the conditions and illnesses I mentioned earlier, then foster carers and kinship carers can certainly connect with our supports. Thank you. Some other questions we get asked, and very relevant for today's session, is can carers still receive support from us after their caring role has ended? The answer is yes, and there are certain situations when carers can connect in with us to access some of those carer gateway services when the person has passed away. We assess these on an individual basis when a carer may want to still receive these supports after their caring role has ended. Can carers still access our services if they don't live with the person they're caring for? And the answer is yes. Many carers don't live with the person they're caring for. The person you're caring for may be living independently, or where a carer, where someone is no longer able to be at home for the person they're caring for, people are still considered carers. The caring role doesn't stop. It looks different, but there is still a lot going into providing emotional support, advocacy, checking in on the person. The caring role doesn't end if the person was living with you or was independently at home before and is now no longer at home, maybe in hospital or in other care arrangements. Can carers still access support from us if the person they're supporting doesn't have a diagnosis? The answer is yes. We do not ask for proof of diagnosis for the person being cared for or require any kind of documentation from health or support specialists. Thank you. So where to from here? Whilst this little session has been brief, I think we do have some time for questions and answers at the end. However, if you do have some questions that you think of after today, you would very welcome to reach out to us. We do encourage you, if you aren't connected with us, to please make contact and speak with us, one of our team members. If what you've heard me speak briefly about today resonates with you and you are a carer and you didn't realise that we existed or supports were available to you, we encourage you to talk to other family members or friends around you that you now realise may be a carer. There may be other person in your network who too is caring for the person that you are as well, may not be online today. And by doing this not only helps carers to realise they're carers, but also the more that you're speaking to people or when you're speaking with palliative care teams or other health professionals throughout this journey, that together people can connect carers up with the information they need. And then the last slide here, thank you, Sarah, I think there's one after this, provides you with our website, our email address, the phone number, and if you do know how to use the QR codes, you're welcome to scan that here, and that takes you to the information on our website. And that 1800 number is the Carer Gateway number, and you are able to connect with Carers SA team when calling from South Australia. Thank you.
Wonderful. Thank you so much, Helen, for your presentation. I think it gives a great starting point. A lot of stuff resonates with me, and I think one of the best parts of my job is, I guess, learning what's out there. So as with that starting point, we'll hand over to Lindsay, who from Palliative Care Connect, and we'll get to the nitty-gritty, the support at home and end-of-life pathway. So I'll just hand over to Lindsay.
Thanks, Sarah. Thanks, Helen. So support at home. I'm going to talk about support at home. I'm going to talk about the end-of-life pathway, and I'm going to talk about what Palliative Care Connect, or the organisation that I work for, can do for you. Support at Home started on the 1st of November 2025, and it really was a response to the Royal Commission into Aged Care Quality and Safety. And the goal of Support at Home and the changes that came about were really to support people to live at home if they wish to do so, and it was safe for them to do so. And that may even include having end-of-life care at home. So it's really about helping older Australians stay independent and maintain their quality of life. So previously, prior to November 1st last year, you may have heard of things called home care packages, and the care itself is somewhat similar, but they're called something different. So the home care packages have now been replaced with 8 care classifications, or support at home funding levels. So there are 8 ongoing core classifications, and there are 3 short-term funding pathways, the end-of-life pathway being one of those, and I'll talk a little bit more about that next. So as I said, Support at Home is a national aged care program that helps older people stay safe at home, and that can offer practical support, clinical support and everyday support, and I'll go into a little bit more detail about what those are on later slides. And again, it includes those ongoing classifications and the short-term funding pathways. So the end-of-life pathway is one of those short-term funding pathways, and it's really designed for people who are in the final months of their life, who want to remain at home for end-of-life care or remain at home as long as it's safe to do so. So some people might go elsewhere for end-of-life, but they can certainly access that funding as they approach the end of their life at home. And it's really for people where their prognosis is expected to be 3 months or less. So the end-of-life pathway provides additional support for up to 16 weeks, and that additional amount of money or support that is provided is $25,000. The funding is available once per participant, and through that money you can access things like personal care, allied health support, equipment, respite, and other in-home services, including nursing. So we'll talk a little bit more about that very soon. Now I've popped this on here for your information. So those 8 ongoing classifications within Support at Home, as I say, there are 8 classification levels. And this is really showing you what the dollar amount looks like for those classifications. So you can see from a classification 1 with an annual figure of $10,000, just over $10,000, to a classification 8, which looks like $78,000 for that 12-month period, or $19,000 for the quarter. So the end-of-life pathway replaces what Support at Home classification someone was receiving, and instead of the quarterly budget for that time period, you would get the $25,000 instead if you were deemed eligible for that service. So again, the 3 short-term pathways are assistive technology and home modifications. There's restorative care and the end-of-life pathway, which again is that $25,000. So who's eligible to access the end-of-life pathway? So you need to be eligible to access services through My Aged Care, so aged 65 years or older, 50 if you're Aboriginal or Torres Strait Islander, and there is a classification that people can access that service if they're at risk of homelessness or homeless. So that would include people who are couch surfing or not are in temporary accommodation. So what needs to happen? A doctor or a nurse practitioner, so a clinician who's looking after someone, or a nurse practitioner who's a specially qualified nurse who would know that person, needs to estimate that their life expectancy is 3 months or less. Now, we like using a lot of big words in palliative care, so we're talking about something called an AKPS score. Now, don't worry too much about what an AKPS score is. It really is a score on someone's function. So we need to look at somebody who's functionally impacted by their diagnosis or where they're at in terms of their prognosis. And that is somebody who's spending at least 50% of their time in bed or in a chair and really not going much further than that. So don't worry about the big words, but really look at how someone's functioning. And again, it's 50% of their time in bed or in a chair. So if you're a GP or nurse who you're working with, and that may be somebody from an aged care organisation or a GP or a specialist, if they think that this applies to you, they'll need to complete a short form in order to start the process to look for the end-of-life pathway and look to access that funding. If you're not eligible and things are changing for you, other support at home services may still apply to you, and palliative care services can and do continue as normal. If it's deemed that you're not eligible, if you have a conversation with a doctor or a nurse that's looking after you and you're perhaps given the information, no, this is perhaps not the right thing for you at this moment, there's still, like I say, there still may be other services that you can access, and I would encourage you, if you're stuck or if things are changing for you or a loved one, please give us a call at Palliative Care Connect and we can look at those options with you and make sure that you're on the right path and connected to the right services. So how do clinicians recognise when someone might need this pathway? And one of the things that as palliative care navigators we talk about with people who call our service, it's having regular contact with a GP, maybe regular appointments, maybe a monthly appointment, maybe a fortnightly appointment, depending on what's happening to you. So your doctor or nurse or aged care provider that's looking after you may look for other things or other clues onto what's going on. So they may look for changes in your health and how you're managing day to day. Things that might be changing at home. You might be having a few falls, you might be going to hospital a little bit more. And those cues are really about raising a flag and getting input and assistance at home. And sometimes a doctor or nurse would say, would I be surprised if this person becomes more unwell in the next few months? And if they're saying no, it might be a trigger for them to think about offering you support or additional assistance or linking you in with those pathways and services where you can find those additional supports. If you're a loved one caring for somebody and you're seeing that things are changing, again, I would encourage you to reach out to us, because if you're seeing these flags that a doctor or a nurse might see, we might be the starting point to get some additional support in the home. Is extra home support at home needed? What support could help us right now, and what's the best way to access that support? Please reach out to us and we can talk through that. We can talk through what the day-to-day for your loved one looks like and what supports and services are available, and whether the end-of-life pathway might be something that you should consider. So if you're already a support at home client and receiving services through support at home, and you feel that this may be an appropriate pathway for you or for a loved one, the first point of call would be to have a chat to your support at home provider. And if the support at home provider is agreeable and they think that that could be a reasonable thing to look at, they could help you fill in a form and upload that to My Aged Care. If you're new to support at home, your GP or nurse or the person who you've had that conversation with about whether the end-of-life pathway is appropriate, they can fill in a form and again upload that to My Aged Care and say that you meet those eligibility criteria. So just going back to what those eligibility criteria is, it's that you have a prognosis of 3 months or less and that you're functionally quite poor, so spending a lot of time in a chair or in a bed. And if you're deemed eligible to receive those services, an assessor will do a quick assessment with you to look at what's happening in the home, and if approved, then you'll receive that funding. And that all happens very quickly. I can reassure you of that from the clients that we've seen access that funding to date. So the type of care that you can receive through support at home and the end-of-life pathway, as I said before, it could be clinical supports, it could be supports to help you maintain your independence with showering, meals, transport. It could be everyday living support. So, you know, I'm not feeling too great. Can somebody come in and do some cleaning, or can somebody take care of the garden for me? Now, are these services free? No, they're not, unfortunately. So from that $25,000 bucket of funding that you have, some of the services that you will access will be free and won't require a client co-contribution. So the clinical services, so that includes nursing and allied health services, are paid for completely from the end-of-life pathway. Other services, the services that sit within the independence or everyday living category, may need a co-contribution from the client, and that co-contribution or the level of funding that you will have to pay for that support is determined through Centrelink or Services SA. Now on the bottom there's a little table there that gives you an idea of what amounts you might need to pay for that care that you're receiving, and again that's determined by Services SA or Centrelink. But if there is some financial hardship, I would encourage you to speak to your support at home provider and just run through things with them, because there may be ways around that. But again, the care isn't free with the exception of nursing care or clinical care. Thank you, Sarah. So Palliative Care Connect, what role do we play in this? Who are we? So we're a really small team. Our services are free and they're there for anybody who with a life-limiting illness. Now, if we're not the right place for you, we'll redirect you to the place that we feel is more appropriate. But we look after carers, we look after family members, we look after patients and clients, and we're experienced nurses and social workers. So I'm one of the nurses in the team. I work with another nurse and 2 amazing social workers. We can access interpreters if needed. There's no referral needed to our service. Anyone can pick up the phone and call and just get some information or advice on what the next steps are. We can point you in the right direction of what care is needed, what care is out there, and link you in with all of those amazing services, including Carers SA. That's one of the big ones that we do refer all of our callers on to. So we'll listen to what's happening at home. We might talk about what the day-to-day looks like for you. We talk about what palliative care is because people often get confused as to what palliative care is and what it does. And palliative care is really about living well with something that's likely to limit your life expectancy, and that includes things like cancer diagnoses, but it also includes things like end-stage organ failure, heart failure, kidney disease, and dementia. We'll connect you with the right services. We'll work alongside the care teams that are looking after you to make sure that all the right people are involved in your care and you have that support team around you. When services aren't available locally, and I'm speaking more so for people in regional and remote areas, we'll leave no stone unturned to get you some support where you are. We might be able to fast track some referrals to different sorts of services for you, and it really frees up time for you to be a carer, or if it's too exhausting, you can sit and rest while we do some of the legwork for you. And we want you to stay where you can be safe and looked after if that's a possibility. Thanks, Sarah. So how the navigation service works. So you can call us. We're 1-800 number, and we're here 8:30 till 4 o'clock, Monday to Friday. When we're not available, you can actually leave us a message and we'll get back to you straight away as soon as we're back at work. Again, we'll listen to what's going on. We'll hear what's happening in your life with your loved one or with you if you're that patient. We'll give you information. We'll give you options. We'll give you advice about the supports and services that are available to you, and we'll make those connections if you need assistance for us to do that. And we might talk to the people that are involved in your care. So that may be your GP, it may be your aged care provider, it might be your family and friends. We'll talk about planning for end of life, we'll talk about advanced care directives, we'll talk about all of those things that need to be discussed as someone's travelling this journey. What we're actually seeing when we're looking at Palliative Care Connect and our role in the end-of-life pathway, and I want to reassure you that when we are seeing people who have been deemed eligible to receive services through the end-of-life pathway, we're seeing that they're picking up that care and being assessed for that care very quickly. So once the documentation is uploaded to My Aged Care, if the person's deemed eligible, we're seeing an assessment happen within a few days, and we're seeing that funding being made available for someone within about a week. We're helping families find providers who can provide that service. So we're having regular meeting with support at home providers and saying, you know, what's your capacity look like? How quickly could you action a referral if you're given, or if you have contact from a family member? And usually that's within a week's time. So there's a very quick response to this care, and people are accessing services where needed. What are families choosing to use this funding for? Some families are choosing to use it to get somebody in the home a couple of times a day to help their loved one with toileting, or maybe help them with a quick sponge bath. Some are choosing to use it for respite care, so big blocks of respite, so that the carer can go out and do the things that they would normally be doing if they need to go and pay bills, they need to go and do the shopping. They're having people come and sit with their loved one. We're finding that with the whole end-of-life pathway, there's better communication between care teams, and it's a smoother transition to end-of-life. And we are seeing that people are able to remain at home if that's their wish and have end-of-life care at home. Again, we want to make sure that you understand what options are available to you, whether you may be eligible for this care, and we want to help link you and connect you with those services where they are appropriate. We'll help you understand Palliative Care Connect, our role, what we can do, understanding palliative care in general and understanding support at home. And we'll give you information that you can understand, and you can come back to us as many times as you wish to ask those questions. If you don't understand, or if you have another question, just come back and ask, because we can help you work through things. Thanks, Sarah. So this is one of my colleagues that's in the middle of this slide. This is Daniel, who's one of the nurses who works with me. And really what our role is as Palliative Care Connect is to link you in with all of these services. And palliative care is not just about one service that would support you at home. So when we talk about palliative care, we talk to everyone who calls our service about building a support team around you. And we've heard from Helen what an amazing support carers are, and we know how much support that carers provide to their loved ones who are travelling this journey. But there are other services and providers that we would encourage that you link in with. So as I said before, your GP, having constant or regular appointments with your GP, so that somebody else is keeping an eye on how you're travelling at home. Might be that you have regular appointments with a medical specialist, could be an oncologist, a cardiologist, but keep those appointments going and keep that those regular channels of communication open. It could be that you go and see a physio, or you have a speech therapist or a dietitian. So these are all part of that support team who would help support you at the end of life, or at this stage in your loved one's journey. Volunteer support programs. There's some amazing volunteer services out there, and Shyla will certainly be telling you about some of those. And we do encourage people to link in with those volunteer supports. Your loved one could be a person who's accessing support through NDIS, If they're age 65 or older and still accessing services through NDIS, there is a possibility that they could also access the end-of-life pathway too. Community informal supports are very important. You know, your church groups, the local Rotary Club. If you're belonging to those groups, then we want to encourage that support still continues. You may have a specialist palliative care team involved in your care, and again, that's something that we can talk to you about. Advanced care planning. What do you want to happen? What do you want the end of your life to look like for you? Who would you like to make decisions for you if you can't make those decisions for yourself? And we can talk to you about those things. There are other sources of information, so digital tools, but I can talk a little bit more about those. And if you want to, if you want to give us a call, we can have a chat about those. But that's really about mobilizing your support networks through family and friends and getting everybody on board to help your loved one. Family and friends and informal carers, absolutely amazing part of this team and this journey, and very vitally important. So very important that we support them too. And obviously My Aged Care and Support at Home. Thanks, Sarah. So this is another one of my colleagues, Niles, who's one of the social workers that works in the team. What can we do as Palliative Care Connect? We can give you practical advice. We can talk about eligibility. We can help you with those referral pathways. We can connect you to those services and supports. We can help you find the documentation that needs to be completed so that you can access those services. And we can have those conversations many times if that needs to happen. We're a phone a friend, and really do think about us as that person on the end of the phone who can answer those questions. If you've got a question and you think, oh, this is a stupid question, pick up the phone and ask us a question, because I can guarantee that it won't be the first time that we've heard it. We want you to get the support and care that you're entitled to and that you need at this stage in your life. We can show you the pathways, we can work through any challenges, and as I said, we'll leave no stone unturned to make sure that you're accessing the supports that are available to you. We can help you with the paperwork, we can help you with the Advanced Care Directives, and we're that guide. As I said, many people who've called our service would refer to us as that phone a friend. So we're that person who you can pick up the phone to many times and say, what do I do next? Help. Who do I need to call? Thanks, Sarah. So within the banner of Palliative Care Connect, obviously Palliative Care Connect is the organisation that I work for, and I'm one of the navigators with the statewide Palliative Care Navigation Service. But there are several services that sit underneath that banner. One is grief and bereavement support, and please do understand that grief and bereavement can start before you lose a loved one. It can start when you get that information that your loved one has a life-limiting diagnosis, and that grief and that bereavement can start at that point, and we can support you along that way. So I would encourage you, if you're struggling, give us a call and we can talk through some supports. We can have a conversation with you and we can ensure that you're supported and surrounded by those people that you need to be. There's an amazing volunteer sector within palliative care, and Shyla, as I said, we'll talk a little bit more about that, but we can link you in with volunteer supports if need be. The Help app is the digital tool that helps you mobilise your own social supports. And if you have a look online, if you've got an Android or an Apple phone, you can sort Google or search the Help app, and that's a way that you can build a team and mobilise your own social supports. And if you get stuck and you don't know who to call, Google Palliative Care Connect. You'll find a link there for our telephone number, so if you don't write it down or if you forget it, it's there online, and you'll find a lot of information that might be useful for you as you navigate this palliative journey. But really, like I said, think about me as your phone a friend, give me a call and we can talk through what you need, what your loved one needs or what you need, and what supports are available to you. So we're here to help, and like I say, no question's a silly question. We've heard them all before, and I will look at some of those questions while Shyla's talking and we can address them at the end of the presentation. Thank you. I'll hand over to Sarah.
Thank you so much, Lindsay. There is a lot of wonderful information, and as Lindsay mentioned, we have some wonderful questions in the chat. Please feel free to type in your questions, and we're going okay for time, I won't speak too early, but we will have some time at the end and we'll take you through those questions. Please feel free. Any question is a good question. So I will now hand over to Shyla Mills from Palliative Care SA, and yeah, I'll take it away, Shyla.
Thank you very much, and thank you to SA Health and the Palliative Care Connect team for hosting this session. We get a lot of questions around this, so it's great to have this information shared, and it's always wonderful to work with Carers SA as well, who do so much in this area. So I'm Shyla, I'm the CEO of Palliative Care South Australia. Palliative Care South Australia is your peak body for palliative care across South Australia. We advocate, educate, raise awareness, nurture compassionate communities, provide support, innovate, and really keep an eye on palliative care across the state. We're an NGO, we're a charity, and it's actually our 40th anniversary this year. So we've been around since palliative care started, and we work a lot in the federal and state space, collaborating with our colleagues at different areas, and also at the international areas of palliative care as well. So today is a great topic, and you can see Palliative Care Connect is a really innovative program in South Australia. It is not available in other jurisdictions at the moment, so be really proud. Use this service as much as you can because it's available. And like Lindsay said, it's an ask us anything service. You know, really phone a friend, give them a call. If they can't support you, they can also document any challenges that they have, which helps us to advocate for improved access to palliative care as well. So please consider using this service and supporting others to know that it's there. It's available statewide for everyone. So that's a great thing to know. So I'm going to talk a little bit about the care economy, which is the bigger aspect of palliative care. We know that over in that last year of life, approximately 95% of the time, you are not connected to a health professional. So you don't have a health professional sitting next to you for 95% of the time, usually. A lot of people think you do have health professionals right there and with you 24 hours a day, but we actually know that that's not the case. Most people are at home with their family, friends, and networks around them in that last year of life. So we need to make sure quality of life is possible for people in that last 12 months of life, all the way through to bereavement support for the families and their carers as well. So that's why this is really important. We also know that most people think that people don't like talking about palliative care, but we did a conversation across the state and we asked people if they were comfortable with discussing death and dying, and actually 89% of the people we talked to said yes. So although we might think people are not willing to talk about it, there is an increased interest in this area and less fear. However, what people told us is that they are scared they might say the wrong thing. So that's really important, and conversations like today, it helps you to initiate things, grow your own confidence in this area. So we'll move to the next slide. We also know that when we ask people about supporting each other and supporting their family and friends, people had different opinions. We said that if your neighbour had a life-limiting or a life-threatening condition, would you be able to help them? And 89% of people said, yes, of course I'd help my neighbour. But then we turned the tables and we said, if you had a life-limiting condition or a life-threatening condition, would you accept help from your neighbour? And it reduced down to 63. So we're better at offering help than we are at accepting. And we know that we need to do something more about this in society, about accepting help from families and friends, particularly in this last chapter of life. And that's a lot of the work that we do. So we do a lot of awareness raising about palliative care, and we have the next slide, which is around describing palliative care in a different way. So a lot of people think palliative care is about sadness, suffering, pain, morphine are usually the words we hear. And yes, that is part of it. It is not always a part of it. And we know if you get good care early, you have a care network and family and friends that wrap around the person with the illness and their carer, that palliative care journey can actually be quite beautiful, and it's helping someone in the completion of their life. So if we take away the fear out of this, we will all die one day. We want to make sure we all have a good end, and that's really important. So this is an example of how we talk about palliative care to everyone. We all need to be a part of this. We will all know people who experience death and dying, loss and grief around us multiple times throughout our lifetime. So we need to rethink palliative care and what that looks like. We hold public education courses, which are available for free across Country SA, and they're supported by the Country SA PHN. These are called Pallilearns, which are described on the next slide. These are also available across Australia, but in South Australia, we host the Pallilearns here. We're really proud. We actually developed Pallilearns, and now they're actually available in over 5 countries overseas as well. So we've shared them everywhere. They've become an international area in this space as well. So if you jump to the next slide, we've got the list of the Pallilearns, which are 8 one-hour topics available online. And like I said, they're free across Country SA. They're a really tiny cost if you're in Adelaide. We just don't have them sponsored at the moment. We also host Last Aid, which is an international training program. We all know first aid. Do we know last aid? And we know that social inclusion and bringing people together and helping people with their belonging is really important. So we have a program from the UK called Talk, Listen and Connect as well. And we have multiple of these coming up in the next couple of months as well. So jump on our website. We'll go to the next slide, and this is what Lindsay was talking about, volunteering. We have a beautiful program as part of Palliative Care Connect called Palliative Care Volunteering SA, and we partner with the volunteering peaks and groups across SA. Volunteering in palliative care is more than social support and companionship, although that is such a big part of it. There's also biography program, the aged care volunteer visitor scheme, nurture backpackers, dog walking, garden grubs, helping in lots of different ways, and we have lots of supports and information there. So if you or you know someone that would like to volunteer in this area, please get in touch with the program and we can link you up and support different areas there. And then finally, our last program I just thought I'd share is the Ambulance Wish SA program. So Ambulance Wish SA is a program that we do in partnership with St John's and Flinders Uni. We have an ambulance and we help take people on their last wish with volunteers. You might remember here our first wish where we took Simon to the Adelaide Oval. He just wanted a beer and a pie at the Adelaide Oval with his mates. Wishes can be really simple. They can be to go to the beach or relive a memory that they love, or they can just be to go home one last time. These are really big, important things for people, and they make a huge difference at the end of life. Now, the Ambulance Wish program is there for people who need the transport assistance, but we know lots of people do not need transport assistance at the end of life. So that's something we tell the community. How about you think of what wish you can help fulfill for someone that you love? What's some local place that they might love to go to again, or some memory they might like to relive? It's something we can all do, and that we know that that brings quality of life at the end of life. And that's really what palliative care is about. So thank you for listening, and I can see some fantastic questions on there. So I'll get back, let it come back to you guys to ask these and share the information. Please visit our website. We have a free e-news that we share each month. We'd love to keep in touch. Thank you so much.
Thank you so much, Shyla. I think we will jump to the questions to fill out the rest of the session. I'll start with the first question. This one's probably for Lindsay. Are the extra supports and palliative care services only for age 65 years and above, or for any age? No extra context, I have clients with terminal conditions under the age of 65 years.
Thanks, Sarah. Great question there. Palliative care is for everyone. So palliative care is about helping someone live well with a life-limiting illness, and we like to sort of put an emphasis on living well. So at the moment where you get that diagnosis that this is life-limiting and we can't cure this, we're looking at care, and palliative care is where that starts. That is for any age. Support at home is a service that's available for older Australians, so 65 years or older, or over 50 if you're Aboriginal or Torres Strait Islander, or again, you can access those services if you're homeless or couch surfing or in temporary accommodation. I would say, Jean, I did see that question. If you have a client that's under 65 and has a terminal diagnosis, please reach out to us. We want to ensure that your clients are linked in with the services that they need at the right time. And whilst it may not be support at home or the end of life pathway that is appropriate for your client, there may be other services and supports that we can link your client in with, or we can give you advice on where to go to get those supports for that client. So please do reach out to us. I'd love to have a conversation with you so that we know that your clients are getting the support that they're entitled to. But no, palliative care is for everybody. Support at home and end of life is for older South Australians or older Australians. Thanks, Sarah.
Thank you, Lindsay. Is that Shyla or Helen, do you have anything else that you wanted to add? Feel free to jump in.
I'll just add on there that we know the under 65 gap. So palliative care is available across the lifespan, whoever needs it, from paediatric palliative care, and there are amazing paediatric programs. And then there's the middle age, which is the up to under 65s, and then the over 65s. So this session's been, like Lindsay said, particularly the over 65s. We know that there is some gaps in this under 65 area between the paediatrics and under 65s. So we are doing a lot of work with Palliative Care Australia about advocating for this. South Australia is not the only area in this issue space. And we are actually collaborating with Palliative Care Australia, who are hosting a Parliamentary Friends at Government House in Canberra, particularly on this under 65s issue. There are webinars available to actually observe this. So if that's an area of interest, please feel free to jump on their website and you can participate and hear what's said at the national level. Thank you.
Going to move on to the next question. It's again probably Lindsay, and I wonder if it's in terms of what services are available under the pathway or more generally. So do you use the services of end of life doulas? So
we have information about end-of-life doulas, and I would say there are some amazing doulas out there, and we certainly have many clients who seek the services of end-of-life doulas. I believe some aged care services are working with end-of-life doulas to offer more support as their clients move to end-of-life. Kangaroo Island is very blessed to have an end-of-life doula who works with the palliative care team over there, and certainly I can give you contact details if you're looking to speak with an end-of-life doula about what services and supports they can offer. Like I say, there are some wonderful doulas out there, and I'd certainly have many of them looking after me at end of life. But we don't certainly have any that work with our service, but they are out there, and I can head you in their direction if you're looking to link in with them.
Oh, wonderful. I just saw Shyla posted something in the chat from Palliative Care SA. Again, let me know, Helen or Shyla, if you want to jump in. Otherwise, we can move to the next question.
I'll just quickly jump in. So there's some great fact sheets there that we've looked at nationally. End-of-life doulas are fantastic. They do operate very differently. So it's really important you ask questions and understand what their different roles are, their costs, and what they can offer is very different across the spectrum. They do now have a certificate 4 in end-of-life doulas, and they also have a, it's like a peak body, a group to bring them all together. So we really encourage end-of-life doulas throughout South Australia to be doing a Cert 4 or to get registered in that Cert 4, and also to join the group, the End of Life Doula National Group as well. So it just provides that support and structure. So there's some good questions that you might want to ask as well, but we do think End of Life Doulas are fantastic in the ecosystem across palliative care.
So this one, question 3, regional and remote locations have very little available, and there is often a lack of funding, resources, boots on the ground. How do we advocate for more support? I will throw this open to anyone who wants to start. Probably Shyla.
Want me to jump in there as the advocacy body? Yeah. So definitely we are aware of the gaps. Palliative care should be available when and where people need it, and you should not be dislocated from your family and your care networks at the end of life. Often that is people's quality of life is dependent on the people around them as well. So we know that is a need. South Australia's population, with around 90% based in Adelaide, is a challenge. You know, we've got this geographic diversity, but we should not be anywhere different when from any other jurisdictions. We should be able to provide that support. So we also are very aware of the rural and regional gaps in palliative care and how we need to support. So if this is of interest for you on an advocacy area, please sign up to our e-news, stay involved with Palliative Care SA around this, and we have lots of community conversations to advocate and support. Stories are really important, and how we can support people in this space is really key. But also we must value what is actually out there. There are some amazing supports and services across Country SA, and they do a lot and go above and beyond. And I know Lindsay and the team are often talking with them as well. They are doing a lot, and we know that community do a lot. We know that there are amazing volunteer services, councils. Carers SA has groups across Country SA as well. So really reach out, know what's out there, and support them. And across this team, between Carers SA, Palliative Care Connect and us, we can link you up to what's there. But when there are gaps, we need to know so we can keep advocating and supporting what is needed across Country SA.
And I'll just add to that, what Charlotte was saying from a very carer-focused perspective is, you know, no one organisation or service can do it all. So between us and the various other services and supports that do exist across the state together, the aim is that they aim to be a complementary support for individuals and families, but acknowledge that there are some gaps, and sometimes it is harder in many areas due to resourcing and distance, etc. In this space, particularly for carers. We are a statewide org, as I did mention, and as Shyla mentioned there, we do have services available, including support groups, but also a whole range of other services for carers available across South Australia. And we also partner with organisations such as Country Natback Health, Carers and Disability Link, MPY Women's Council, and various other organisations who are able to have a footprint and support carers in regional South Australia.
Thank you so much, Helen. I'm just conscious of time and tying things up so we get there. We have one more question. It's a quick question probably. Is the CHSP, which I continue to have to remember, is the Commonwealth Home Support Program, is there reclassifications or anything changed? And yeah, is it just a question of, yeah, maybe Lindsay, if you could quickly.
Sarah. David, CHSP or Commonwealth Home Support Program is the entry level into support at home. So CHSP is continuing until 2027, at which time it will merge into the support at home. So CHSP services still exist, and if that level of support is enough for you, then that will continue. I would say that if you feel that your needs are changing or you're needing additional support, it might well be that you need a new assessment, and at that point they may choose to increase your services to support at home level services. But again, if you're struggling to understand what's happening, please do get in touch. We can talk through that and what's available or how you best use those CHSP services that you have approval for. And one last thing, we do have a fact sheet at Palliative Care Connect. If you have approval for the end of life pathway, we've got a list of questions that you may want to ask the provider when you're talking to them about accessing the end of life pathway through them as well. But again, please reach out. Any questions that I haven't managed to answer, we can do so, and we can chat about what's going on for you.
Thank you so much, Lindsay. I'm going to tie this session, bring it to a close. I would really like to thank Helen, Shyla and Lindsay from the bottom of my heart. It is wonderful to have such passionate and informative sessions and bringing this information to the community. Again, thank you so much and have a great rest of it's Wednesday today. Have a great day, everyone. Take care.